Hi everyone, I am Richa Sehra, Editor-in-Chief Responsible Hospitals, and today I would like to welcome all of you on our Insta Live session. So today's session is more about after having a lot of demands from people, we thought we'll be doing a session on you know the corona wave which has come up now again. Initially, people were not so sure about it, that what to do, what not to do, but now people have also understood a lot. But then still, there is a wave of panic which people do. They are not able to understand what happens when a family member gets a corona, and when they see the positive feature, they themselves get more stressed, but they really do not know what to do as a first step. What is the severity now? And a lot of questions around it, whether they have to get admitted in the hospital there and then, or there are possibilities within at your home or at your doorstep. So we're going to talk about all these things today with Dr. Sfurti Mann, who is a senior physician and diabetologist, one of the famous and popular doctor in the industry of Gurgaon, and she will be helping us out with a lot of questions and answers. So, team, if you can just connect me with Dr. Sfurti Mann, and we'll start the session soon without wasting a minute. So, guys, in case you have anybody who is, I'm sure because now this is the third wave, and a lot of people are already facing, these kind of challenges of getting plasma, getting therapies, and they are looking for people who have gone through from corona already, they've recovered. They really do not know how to find out the right people. Also, along with it, I'm sure many of us now have seen either the COVID thing, or they have some members in the family who have either gone through or they are already facing. So I think it's a time to talk about it, talk about the severity, what are the challenges, what are the guidelines, what are the symptoms, so that we can actually get ourselves ready for it and keep ourselves well and aware. So I think this is the time where people should be more aware. They should not be thinking that COVID has gone. There are a lot of news around the vaccinations around it. The interesting part is that this is a great news which we are getting end of the year, thinking that now finally we are getting to know that the vaccinations are coming up, and I'm sure everybody will be able to get that sooner in India as well. So that's a good news which everybody, but still we have to be extra cautious. Even now we should be very much aware about what needs to be done, what needs to be taken care. People are not taking it very seriously, but I think this is something which people should not be forgetting, that we have not got the vaccination yet, and yes, we have to take care of ourselves and our family members. So it's time to understand that how crucial that is even now. What We'll be talking about it in detail, and Dr. Sfurti Mann will be with us live today. So good evening, Dr. Sfurti. How are
Hi,
you
hi,
doing?
hi, good evening.
It's good to see you virtually again.
Yeah.
Yeah, so Dr. Sfurti, as I was talking to our audience, saying that again the corona wave has come up so fast, and this is the third wave people have been saying. Uh,
Hmm.
what do you think that how people are taking it, how severe it is? We can just start with it because today's
Hmm.
topic is more about again COVID.
Hmm.
Yeah.
So severity, as I would say that there is varied manifestations. They are asymptomatic, mildly symptomatic, and mild cases, moderate cases, and then they are very severe. So they are
Mhm.
all known types.
So, seeing that the scenario that initially people were very scared about COVID, and nowadays they are actually roaming out so free, thinking that
Hmm.
the vaccinations are out.
Hmm.
Even now, I mean, there are only news that has not been out, but then the feelings are like that. People are so happily enjoying all the outdoor
Well,
things.
that's the
They are not
irony.
taking care of
That's the
themselves well.
irony of the situation. जब कोविड नहीं था तब इतने precautions and cautions and fear and everything. Now it is everywhere, and nobody seems to be bothered. That is why we are seeing more and more cases.
Right. So, the topic of today is, doctor, that there is a feeling of panic when it comes up in your family.
Hmm.
Otherwise, we do not care much. The moment you get
Hmm.
somebody, your known person who gets it, or let's say somebody getting in your family, there is a panic situation in the house, thinking
Hmm.
that he's COVID positive. So
Hmm.
even after knowing a lot of things, people
Hmm.
seriously do not know what needs to be done step by step. So what do you
Hmm.
think when somebody actually gets it in the family?
So
What is
symptoms is
something
the
which they have
first
to do
thing
it?
before even you get yourself tested. So आपको अगर बुखार है या फिर sore throat है या खांसी है, so symptoms is the first thing. So
Okay.
isolation is the first thing, before even you get yourself tested. So that is
Mhm.
the first.
So, are you saying that even if somebody, because it's a viral season also, along with
Hmm.
COVID, so even somebody is getting cough and cold kind of
Hmm.
thing, they
Hmm.
should isolate themselves and
Yeah,
immediately get a
absolutely.
COVID
Because
test done?
सिर्फ सिम्टम से ही हमें 100% डायग्नोसिस कि ये सीजनल फ्लू की वजह से है, कोविड-19 की वजह से है, किसी और रीजन की वजह से है, पोल्यूशन की वजह से है. So सिर्फ सिम्टम्स के बेसिस पे ही हमें वो 100% तो श्योर नहीं होता. So first thing is
Sure.
that you isolate.
Okay. Okay. So, once they isolate, they should be calling somebody to get the test done at
Yes, जिस
home.
दिन आपको सिम्टम शुरू हो, आप उसी दिन या उसके आगे दिन. यू डोंट हैव टू
Hmm.
वेट फॉर अभी हम 5 दिन 6 दिन अभी थोड़ा सा वेट करो. सो वेट करो वाला सीन कोविड-19 में नहीं है.
Okay. Okay.
यस,
So
यू
sometimes
मस्ट गेट
they
योरसेल्फ
get in touch
टेस्टेड.
with their doctors. They want to know their opinion, and doctors also tell them to wait at least for 2 3 days. Could be viral, and I think by the time they are
So
actually
that is a
infecting other people.
misconception for which I'm here to tell people that
Sure.
ना अब तो सस्ता टेस्ट है, why not get it tested. अगर नेगेटिव है तो बहुत अच्छा है, but there's no
Mhm.
reason that you shouldn't.
Mhm.
Because you may be
Okay.
having a mild disease and you could infect, and somebody जो elderly है जिसको diabetes है या कुछ है, that person might catch a serious type of a disease. So
Okay.
it's better.
Sure. So as soon as they get fever, doctor, then what is the next? I mean, after, let's say now they are positive,
Hmm.
somebody is positive in your family, and you have isolated them. Then what
Hmm.
is the next step which needs to be taken care?
So आप किसी ना किसी फिजिशियन के टच में तो हैं,
Mm-hmm.
है ना. सो आइसोलेशन के मिनिस्ट्री ऑफ हेल्थ उनके वेबसाइट पे व्हाट एग्जैक्टली नीड्स टू बी डन, वो सारी चीजें बड़ी डिटेल में दे आर लिस्टेड. कि आप सिंगल
Okay.
रूम में रहें, प्रेफरेबली एक अटैच्ड टॉयलेट बाथरूम वहां पे हो. That's the first thing. All the time you have to wear this.
Mm-hmm.
You have to take care of your hand hygiene and your respiratory hygiene. So what is respiratory hygiene? So when you're coughing or you're sneezing, you don't do this. You do this. ठीक है,
Right.
आपको है
So
तो
these are the
बाकी
small
लोगों को भी
factors I
टेस्ट
think people should
सिम.
know.
These are the small things which yes matter. तो ये
Mm-hmm.
सारी चीजें उसमें लिस्टेड हैं. वार्निंग सिम्टम. आप होम आइसोलेशन के लिए एलिजिबल हैं.
Mm-hmm.
So that only a qualified, physician or whoever who is treating you. Because what is happening is home isolation, people think that, everyone can be in home isolation. But अगर कोई कैंसर का है पेशेंट, ठीक है, इम्यूनो
Mm-hmm.
कॉम्प्रोमाइज्ड है, HIV का है, शुगर इज एक्सट्रीमली हाई, लंग का कुछ डिजीज उनको है, सो वी हैव टू थिंक whether this patient is eligible. सो ओनली माइल्ड केसेस या बिल्कुल एसिम्टोमेटिक केसेस या फिर जिनके प्री सिम्टोमेटिक, सिर्फ वो ही होम आइसोलेशन के लिए एलिजिबल है.
Okay.
So
Sure.
because what we are seeing in practice is कि oxygen saturation is, so timing is crucial. If you're noticing that the saturation is dropping, या फिर कुछ खांसी वगैरह है. So those are the indications that the patient should be, immediately hospitalized.
Sure. So, Dr. Sfurti, just tell me one thing which I think a lot of people would want to know, that how to actually differentiate the common flu and the COVID. Is this the only test which is something which is viable, or initially also we can get to know about it? Can you hear me? I'm losing the network.
Hear me?
Can you hear me now? Yes, I can. I think the network at your end is a bit slow. Yeah, I'm just losing the network at your end.
Mine?
Looks like you need to change the place.
No, it's my network. Yours or
Yeah,
mine?
yeah.
Now?
Yes, I can hear you now. Yes, please go ahead. So I
Huh.
was asking that
So what was the
how to
topic?
differentiate between the common.
So only on the basis of symptoms, honestly speaking, it is right very, very difficult. Because in COVID, we are seeing asymptomatic cases, mildly symptomatic cases, moderate cases. So mildly symptomatic cases में तो वो खांसी जुकाम की तरह हुआ. So only on the basis of differentiating it from seasonal flu, it is very difficult. Sometimes you
Okay.
must just एक दिन का बुखार है, थोड़ा सा nasal congestion है, थोड़ा सा sore throat है, तो it can be a seasonal flu, but it can also be COVID. So unless you get it tested, you will never come to know.
So, doctor, since you've just mentioned that other youngsters hai, yeah, they don't have any back history of any other problem like sugar and diabetes or something like that. So, what do they do now? Because everybody's saying ki, uh, everybody is actually suggesting na different kind of medicines. Like I keep on getting articles from different kind of people saying एस्प्रिन ले लेना चाहिए क्योंकि वो ब्लड को थिन करता है, ब्लड सर्कुलेशन बढ़ाता है, एंड देन जिंक कोविड लेना चाहिए एक बार. तो क्या लेना चाहिए, क्या नहीं लेना चाहिए, कितना लेना चाहिए?
हाँ, क्या लेना चाहिए, क्या नहीं लेना चाहिए, वो सिम्टम्स क्या है पेशेंट के, रिपोर्ट्स क्या है, बिकॉज समटाइम्स व्हाट हैपेंस इज COVID-19 RT-PCR टेस्ट that is positive, but after the test patients do not get any test, है ना. तो सीआरपी इज समथिंग जिससे हमें पता चलता है कि कितना लेवल ऑफ इन्फेक्शन है,
ओके.
हाउ एग्रेसिव हमें इसको मॉनिटर या हमें इसको ट्रीट करना है.
ओके. सो आर यू सेइंग कि कोविड टेस्ट के बाद जैसे उसका पॉजिटिव आता है,
सीआरपी है, डी डाइमर है, फेरिटिन है, एलडीएच है, so there are a whole lot, but
Okay.
if you only want to get one test, then that would be CBC and a CRP.
ओके.
So CRP अगर 10 से बड़ा हुआ है, so we can get a early indication कि हाँ हो सकता है कि फ्यूचर में निमोनिया या कोई सीरियस कॉम्प्लिकेशन इस पेशेंट को हो.
That's true, I think, because I also know a very young guy in my known, and he immediately got the COVID and then pneumonia, and that
Yes.
pneumonia has affected him a lot. He's still not
Yes.
getting his negative report.
So sometimes we are under the impression that we are below 35 or we are below 40, तो हमें तो कुछ नहीं होगा. But believe me, we have seen in clinical practice and we are seeing on a everyday basis, there may be a 75-year-old जो एडमिट होके अच्छा खासा हंसता खेलता हॉस्पिटल से डिस्चार्ज होता है. There may be a 25-year-old who will get a serious disease. So weird disease है, and why the whole world is panicking and everything, so there are reasons.
Absolutely, I think
So at
this
the
is a
same
message
time,
for
what happens
everyone.
is that people get mild diseases and they make fun. अरे इसमें तो होता ही नहीं है, हमें तो हुआ था, हम तो nothing happened. So they spread the message कि COVID-19 में ऐसा कुछ सीरियस वाला है नहीं है, ये तो ऐसी ही प्रोपेगेंडा टाइप का इन्होंने क्रिएट किया हुआ है और हमें तो था एंड वी आर ओके. So that is a wrong type of message.
So
Because
this
you
is
might not
just
have
to
had,
calm
but anyone
yourself
can have.
with your own positivity. This is just to relax your own inner powers.
हाँ, so they feel कि उनको क्योंकि माइल्ड डिजीज ही थी या प्री सिम्टोमेटिक ही थी, बस एक ही दिन का बुखार था, ये क्या कोविड को लेके इन्होंने इतना अल्लाह अल्लाह मचा रखा है, कोविड इज नथिंग. So that sends out a message कि भैया COVID is nothing. It is a usual खांसी जुकाम. Now it may be a usual खांसी जुकाम for 70 to 80% people, but it is making people sick also.
Absolutely, absolutely. So, where were we? So you were saying, doctor, that there are a lot of tests which are to be done. So what next? I mean, just tell us the process. I mean, still it is unclear to a number of people that कब कौन सा टेस्ट कराना है और अगर वो कोविड उनको हो गया है तो कितने दिन के बाद उनको दोबारा से टेस्ट कराना है. क्या वो बिल्कुल ठीक हो गए? आर दे रेडी टू बी आउट और दे
So guidelines इसमें मिनिस्ट्री ऑफ हेल्थ का है. माइल्ड केसेस में 10 days के लिए यू हैव टू बी अंडर कंप्लीट आइसोलेशन and you can come out of the isolation after 10 days provided आपको last 3 days में फीवर या कोई और symptoms नहीं थे.
ओके,
ठीक है. अपने घर से बाहर जाने के लिए हमारा 17 days का है. तो 10 days में आप अपने रूम से बाहर और 17 days में घर से बाहर. So mild cases, a repeat RT-PCR test is actually not needed.
okay, okay.
So these are the guidelines.
Okay. So are you saying कि उनको अगर ठीक लगता है तो they can start getting themselves, you know, they can go out and all. But does the test require again or not?
No, mild cases जो कि होम आइसोलेशन में है उनको रिपीट टेस्टिंग की जरूरत नहीं है.
Okay, sure, understood. And let's suppose somebody is developing more symptoms कि मुझे 2-3 दिन 4 दिन तो उसको अच्छा लगा लेकिन उसको लगा वो रिकवर कर रहा है बट 7th 8th डे उसको कुछ
तो
और होने
निमोनिया
लग जाता है.
निमोनिया होने के पूरे पूरे हिसाब से. तो द मोमेंट यू नोटिस कि फीवर आपका जो है रिड्यूस हुआ ही नहीं या फिर था रिड्यूस हुआ फिर वापस से आपको फीवर है, वापस से आपको कुछ खांसी या चेस्ट कंजेशन या चेस्ट पेन या वीकनेस या कुछ है, यू नो योर सिम्टम्स. So ideally these patients should not be home isolated. Ideally these patients should be hospitalized.
So जैसे ही उसको निमोनिया या इस तरह का कोई भी सिम्टम मिलता है
वो अपना
you're saying
सीटी
they
स्कैन
have to
सबसे
get
पहले तो
isolated.
यस दे शुड.
But now
एक तो अपना सीटी स्कैन करा लें
okay,
अगर डाउट है या फिर अगर इनहिबिशंस हैं, रिलक्टेंस, तो because you know what happens in these COVID admissions is that people are also under the impression that not only will this be an admission, this will also be an isolation. So it has a very negative psychological impact. So कम से कम वो अपना एक सीटी स्कैन वो करा के देख लें. So significant pneumonia है तो please get admitted.
हाँ, that's what I'm saying. Unlike that, doctor, एक और चीज है which is bugging, I think, everyone's mind. I don't know on what extent it is true or not. First thing is they say कि कोरोना का patient है, the hospitals are admitting the patients and the senior citizens हैं तो chances ही नहीं है बचने के. Mostly they wanna take them क्योंकि body भी नहीं आनी and all that. These myths, how true that is. So they are scared themselves to get themselves admitted. First of all, I think बहुत सारे लोग इसलिए admit भी नहीं होना चाहते. Can you hear me? I'm losing the network at your end.
Yeah, I think I lost you.
Yeah. So I was saying that बहुत सारे myth हैं ऐसे hospitals को लेके people are very scared just particularly for COVID purpose. They don't want कि admit होना है. Admit मतलब they are very scared of it.
So they delay that. They delay the very important. जैसे I had a patient for 4 days. I've been asking her to get admitted, and today she came in a very serious kind of a condition.
Okay.
So early treatment when we recognize कि निमोनिया है, बढ़ता हुआ डिजीज है, so early treatment is very 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 important. उसमें आप घर में ऑक्सीजन लगा के रखो, कुछ कुछ इंतजाम करके रखो, इट नॉट मैच द टाइप ऑफ हॉस्पिटल ट्रीटमेंट दैट यू मस्ट हैव.
Okay.
तो उसका आउटकम क्या रहेगा, सर्वाइवल रहेगा नहीं रहेगा, दैट इज सेकेंडरी. व्हाट आई एम सेइंग इज दैट अ फेयर चांस, you know, for treatment that should be given.
Sure.
And
So at
those
that time also,
inhibitions are only initial. जब वो आते हैं, एडमिट होते हैं, तो उनकी सारी एंजाइटीज जो है अपने आप when they see कि हाँ आसपास और भी पेशेंट इस तरीके के हैं, स्टाफ भी हैं, डॉक्टर्स भी उनको देख रहे हैं, तो उनका वो जो एक एंजाइटी है कि पता नहीं हॉस्पिटल में किस तरीके से करेंगे, अपने रिलेटिव्स को हम मीट नहीं कर पाए, तो वो सारी चीजें ना धीरे धीरे उनकी अपने आप ही ठीक होती हैं. And we've been discharging 75-year-old to 80-year-olds. 85 ऐसा नहीं है कि आप ओल्ड एज है एंड कोरोना है तो डेथ है.
or hospitals maybe, I think there is a issue going on saying that there are no beds. Some of the hospitals have no beds now, so people are actually doing betting on कितना एक्स्ट्रा पे करके किस हॉस्पिटल में हमारा हो सकता है, all that,
At least
because
in
they
the
are not
hospital
getting
that I
admissions in their
work,
own
there are
private
fixed
hospitals.
prices, and the government has capped it at 15,000 on a daily basis or 18,000 depending on ICU में है कि कहाँ है patient. तो वो government की capping के हिसाब से.
Okay,
तो
sure.
it's not a betting, पता नहीं अगर कहीं पे है तो. At least I'm not aware.
So शुरू में आपने जो
बेड्स
बताया
का
कि
शॉर्टेज तो है. इफ यू रिमेम्बर 6 months अगो ऑल्सो वी डिस्कस्ड कि
राइट,
अगर बहुत फैलेगा तो हो सकता है लोगों को होम ऑक्सीजन एंड होम ट्रीटमेंट का जरूरत हो, बिकॉज बेड्स का एक क्रंच तो है.
true. So doctor, one more thing, like you just clearly mentioned that कितने दिन में कैसे कैसे आपको symptoms आ रहे हैं, कैसे कैसे आप recover कर रहे हो, that is very important. So what do you think कि इन दिनों में वो किस डॉक्टर के साथ कनेक्टेड होते हैं? Are they connected people like you who are general physicians who will be guiding them on the every step कि अभी तुमको ये टेस्ट कराना चाहिए, या now this is the time you should admit yourself? Who are these? I mean, these are
Of
general
course, there's
physicians who
a
are guiding
general
them,
physicians, there are internal medicine, like I'm an internal medicine specialist.
right?
MBBS जनरल फिजिशियंस, तो वो किसी ना किसी या फैमिली फिजिशियंस या अच्छा 60+ जो है या कोमोर्बिडिटीज जिनको है, डायबिटीज भी है, ब्लड प्रेशर भी है, उसको उनके फिजिशियन ने कहा है कि आप होम आइसोलेशन के लिए एलिजिबल हैं. सो एट दैट टाइम द फिजिशियन शुड आल्सो इंश्योर कि किसी भी टाइम कुछ होता है तो वो फिजिशियन उनके लिए अवेलेबल है.
True.
Right. You
Because this
just
is a
can't,
responsibility.
because this is a responsibility. You just can't ask someone to be under home isolation and then just leave it. Because if it is a serious disease, तो वो 3 weeks से लेके 6 weeks तक, you know, the patient has to be watched.
Absolutely.
So, and if the physician feels कि नहीं sugar out of control है, blood pressure का भी issue है, अभी तो आपके symptoms इतने serious नहीं है, but I feel that personally, ideally, आपको hospitalize हो जाना चाहिए. So like I tell my patients that the best is that you get hospitalized. अब patient को नहीं होना है या कुछ ऐसा है तो that is a different thing.
Understood.
But even
Sure.
then we tell them कि ये warning symptoms ये हैं, ये tests हैं, ये आप करवा के और हर तीसरे दिन चौथे दिन आप जो है दिखाओ. Anytime you see that the oxygen saturation is less than 94, 95, तो आप तुरंत से जो है you get admitted.
Okay. So doctor, जिन लोगों को COVID हो गया है and now they are fine with it, are there any possibilities to catch it again? If yes, how frequent? I mean, what will be the frequency of getting it?
तो देखो, by experience we can see that there are not too many cases of reinfection.
Okay.
We've seen so many cases, but we are not seeing too many cases of reinfection. तो करोड़ के करीब तो हिंदुस्तान में भी केसेस है. सो अगर रीइंफेक्शन इतना फ्रीक्वेंसी से होता, so we would have had like uncontrollable, you know, infections. but we're not seeing too many cases. But worldwide को री-इन्फेक्शंस के भी केसेस हैं. सो टेंटेटिवली 2-3 महीने की इम्यूनिटी प्रॉबेबली है, लेकिन उसके बाद आपको री इन्फेक्शन होने का चांस है. जो वो कहते हैं कि शायद फर्स्ट इन्फेक्शन से कुछ इम्यूनिटी है, तो सेकेंड इन्फेक्शन शुड नॉट बी दैट सीरियस.
Okay.
But that doesn't mean that if you've had an infection, so this is one very frequently asked questions कि अब तो वो हो चुका है तो मास्क लगाने की जरूरत है क्या?
Oh
So these are
God.
COVID appropriate behaviors. कोविड एप्रोप्रिएट बिहेवियर्स अभी आपको पता नहीं कितने टाइम के लिए उस तरीके से बिहेव
True.
करना होगा, जिसमें मास्क है, रेस्पिरेटरी हाइजीन है एंड हैंड हाइजीन. तो कोविड हुआ है या नहीं हुआ है, मास्क और हाथ धोना एंड दिस कफिंग एंड स्नीजिंग इन योर एल्बो, दिस थिंग हैज टू कट.
Absolutely.
एंड
I
पोस्ट
agree.
कोविड योर इम्यूनिटी हैज ऑलरेडी टेकन अ हिट. If COVID nahi, तो you can catch other respiratory, other secondary bacterial infections.
True.
So I
Sure.
talk about swine flu and sometimes patients ask me कि swine flu ये अभी है. So they have not gone anywhere. They are there. They're there since 10 years. So if now with a lowered immunity, you've also lowered down your guards. आपके पास mask नहीं है, not washing your hands, you're just not bothered. So you'll catch the other infections.
True. I mean, you are absolutely true. Because of the COVID now, बहुत सारी चीजें people have they are just missed. They don't even realize that, and there's something else.
I also emphasize through this platform that there are flu vaccines, there are pneumonia vaccines. Every 50 plus, 60 plus should be taking these pneumonia vaccines. Flu vaccines, so annually, all of us should be taking. So they do not provide 100% immunity. They do provide a 40 to 50% immunity.
So it's not going to create any magic. We still have to take
it's not
the
create
fast
any magic, but why not take them? So they're so obsessed कोरोना की वजह से ना, they're not interested in the usual flu vaccines,
Right,
the
right.
pneumonia vaccines. So those are
Right, right. I
important.
think this is the message which should go to everyone who is listening to us and who is watching us, that we shouldn't be forgetting about the other diseases and other vaccinations, other problems, which not only COVID is something which is impacting our life, there are something else also. So which should be taken care. So it's
So
our own
adult
personal health which is
vaccinations
important.
in India, the awareness about adult vaccinations. So when I talk about vaccinations to people, there may be just 1 out of 20 patients who's aware of, there are certain vaccinations to adulthood, maybe, they're useful. So those adult vaccinations, you should ask your physician.
Sure. Thank you so
So
much,
chicken pox is
Dr.
one
Sfurti.
thing.
This
I
is
saw one
really
patient जिसको COVID-19 था और साथ में बेचारे को chicken pox था.
Absolutely. I think I am also hearing these things. किसी को डेंगू और वो साथ में हो रहा है COVID
Yes,
भी.
these are co-infections. So co-infections, they happen because एक disease की वजह से आपकी immunity पहले से ही lowered. जो जितने भी वायरस dormant और latent आपकी body में हैं, वो भी activate होते हैं. So had this person taken a chickenpox vaccine, which has a 99 to 100% efficacy, he would not have developed at least chickenpox.
True. That's absolutely true. I think very, very insightful session, Dr. Sfurti. Thank you so much. It's really great and pleasure to have you all the time whenever I do my session. And I
Likewise, I
myself get
love
so
talking to you.
aware about so many things. And thank you so much.
All right, this has been a short session. Are there any questions that you want to ask from the
No,
audience
I
or?
think nowadays we are not taking questions much.
Acha.
It's just that in case somebody reaches out, we just connect them with you. The screen has
चलो.
lesser questions today.
अच्छा. चलो ठीक है.
Sure. All right. Thank you
That's
so
about
much,
it.
Dr. Sfurti.
All
Bye-bye.
right.
Bye.
Bye bye.
Bye.
Bye bye. Take care. Bye.